Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the brokerage for 15. So give us a call, I'd be happy to chat with you. Today's topic is how essential is it for a buyer of a dental office to purchase the real estate where possible in the sale of a dental office. We'll get into that. As you know, we're doing this now 15 years. We have 10 employees. We're in 25 states. And we also have 2 CPA accountants to assist you. So give us a call anytime. Now, we're working 363 days a year. We take off Christmas and Easter. We are available to you from 8:30 a.m. till 8:30 p.m. East Coast time every day. So just give us a ring. We'll be happy to take care of you and go over everything with you. Free advice at any time. Even if you wanted a value of your office, we can give you some rough idea. So please call us. Now, also, if any of you are you have a larger office thinking about selling to one of the DSOs, give us a ring because they'll often pay our commission, even though we don't work with them. We work with them, not for them. So it works out quite well. We could be your advocate and it won't cost you anything. And we know who some of the better DSOs are. Also, if your practice, any practice that we're representing sells for over $1 million, based on minor criteria, we will reimburse your legal fees upon successful closing. So call us about that. We've done that multiple times. Anyway, the real estate. Knowing what I know, after 15 years, if the real estate is within some kind of reach, and that mortgage of the real estate is somewhat close to what your lease would be, I would always recommend, my opinion of course, I'd always recommend buying the real estate. I wouldn't even think about it. The aggravation we go through with some of these attorneys, some of these landlords, you wouldn't believe it. And who's to say the landlord who's a great guy today, you got to look out 25 years from now. Will that be the same landlord? He could be the greatest, or she could be the greatest. But 25 years, they could sell it, pass it on to an heir. Anything could happen. And it'll be a nightmare for you when you go to resell it. I know 25, 30 years from now, you're not worried about it, but you'd be surprised how fast 10 years goes past, let alone, 30 years. It is a nightmare. Now, secondly, it's an investment in your future. It's equity on day one. When you lease a property, yes, you could write it off, but you could also write off the mortgage. And at least you have equity going into something. And not only that, when the patient knows that you own the building, they know you'll be around a long time. So it has a different flavor to it when you own the building. So I would definitely own, if possible, the real estate. Now, I was fortunate. I bought my building right away. I bought the building, the practice, the parking lot, the 2 apartments in one sweep as soon as I got out of my residency. 6 months after, boom, I bought everything. And you always want to own the real estate if you can. Always. Forgetting the appreciation which may occur or may not occur, but it usually will occur. Usually it's going to stay about the same price. It's the autonomy, the freedom. And then in 25 years, selling it, you don't have to deal with the landlord. You can have a landlord really giving you a hard time trying to sell your office. You want to have that freedom. And if the buyer doesn't want to purchase the dental office, real estate, well, what are you going to do? At least you have control over it, and you could dictate terms. But where possible, always sell it. And landlords and owners of dental offices that own the real estate think they want to earn the income for the next 10, 15 years from the real estate. Not a wise move. It's the time value of money. Cash out now. You don't want to be a landlord. You're thinking about a landlord 1 year, 2 years, 3 years. You got to look out for 10 years. And nobody's buying your building if they're not an owner-operator. In other words, if you lease it out and that dentist doesn't want to buy it, the chances of you selling the building are a bit more challenging, because the person that would buy your type of building, which is usually self-standing, is going to be an owner-operator, and they want to own the business, they want to own the real estate. So, you may lose out a little bit on the rental income, but you'll make it up on the time value of money. Time value of money is very, very, very valuable, and you've got to look into that. So I want you to think about that. If the real estate's available, buy it. It's for your benefit. You'll never have to deal with the landlord. Never, ever. And some landlords are nightmares. You'll never have to deal with one. The roof leak, the problem, the electricity, it goes on and on and on. There's no end to it. Believe me, you'll regret it. And you may not want to take care of a property, but, you're going to have responsibilities anyway, even if you're just a renter. So there may be circumstances where you don't want to own the building because you're a short term, but usually you're going to need a 10-year lease from the bank. So whether it's ownership for 10 years or the real estate for 10 years, generally the bank will fund it for you. Remember, the bank is basing everything on the cash flow of the practice and the real estate. They know if the mortgage on the practice is going to be, on the building, is going to be similar to a rental, they'll go for buying the building. And if you don't have the down payment, usually 15%, there are things that can be worked out with the bank. Excuse me, I'm at an intersection. There's usually things that can be worked out with the bank. They can increase the price of the practice so you don't have to pay as much down payment. Or there are times that if you're buying the building and the practice and you need that 15%, there are times that the landlord will hold the paper. In other words, do a second mortgage for you. That's quite possible. And I've had many situations like that, because the landlord got all, the owner got all the money for the practice and 85% of the money for the real estate. They'll sometimes go for a 10 to 15% note or hold the mortgage so you don't have to put the down payment down. That's on an individual basis. But when in doubt, buy the real estate. Buy it. You'll feel better. Any improvement you make is yours. It's the way to go. Buy the real estate. Remember, Dr. Gary told you. Hopefully you'll thank me someday. All right, team, we are looking good. Thank you for listening. We've got a couple more beautiful days here in New Jersey, trying to enjoy it while we can. I'm about to go on a bike ride. Just came from a nice car show. And I'm working all day too. Went swimming this morning, but I don't mind working. I'll go sit out in my big yard here, overlooking the stream, and I'm doing paperwork and having a blast. Great to talk to you today. Hope you're having as much fun as I am. Talk to you soon.